for national statistics shows that coronavirus infections are continuing to rise across the UK, but there is one glimmer of hope. It does suggest a slight slowing in the rate of growth of the infection, with the R number decreasing a little to between 1.2 and 1.4. So is this a sign that recently imposed restrictions are starting to have an effect? Or does it imply further measures might be needed? Well, this morning we can ask Professor Neil Ferguson. He is Director of the MRC Centre for Global Infectious Disease Analysis at Imperial College, and his work informs a lot of government thinking. Good morning, Professor Ferguson.
Good morning.
So, the growth of infections has slowed but is still rising. What can we take from that? That restrictions are working or that they're not?
I think it's too early to say regarding restrictions. I think we'll have to wait another week or two. I think what's going on in terms of the slowing is really that we saw a very large epidemic in university students in the last few weeks. And so if you break down that data, the case data every day, and indeed those survey data, what we're seeing is case numbers coming down quite quickly in a narrower age band in 18 to 21-year-olds. And that's slightly distorting the picture overall. Unfortunately, in every other age group, case numbers continue to rise at about the same rate they were. There are little hints of slowing in, for instance, the northeast of England, but at the moment, we're not seeing the sort of slowing that we really need to get on top of this.
And are you seeing a significant difference in places where the restrictions are tighter? So, for instance, across the central belt of Scotland, we've had really quite tight restrictions for just over a fortnight now. Manchester, Sheffield, other places have gone into tier 3. Some of them have had tighter rules for a while now. Is it obvious that these make a difference to the rate of infection?
It's not obvious as yet. There are hints. As I said, northeast is probably the area where some of those restrictions have been in place for a considerable period of time. There is a hint of slowing there, but it's a slowing of the rate of growth rather than the turning over the curve. I think we will need to wait another week or so before we can make definitive conclusions, though. And it is a worrying situation. We now have 8,000 people in hospital with COVID. That's about a third of the level we were at the peak of the pandemic in March. If the rate of growth continues as it is, it means in a month's time we'll be above that peak level in March, and that's probably unsustainable. So we're in a kind of critical time right now. The health system will not be able to cope with this rate of growth much longer.
And so we've got regions of England going in and out of tier 2, tier 3. We've got 5 new tiers coming in Scotland soon. And we've seen Wales go into what's pretty close to a total lockdown now. Is that what's going to be required, do you think, in order to really get on top of this?
So I think the key measure in both tier 2 and tier 3 and the equivalent tiers in Scotland is the restrictions on households mixing indoors. That should have a significant effect, but as yet we haven't been able to see it definitively. If we go beyond that, there's a limit to what we can do in terms of reducing transmission, reducing contacts, short of starting to target, for instance, the older years in schools and sixth form colleges, where we know older children, older teenagers are able to transmit as adults. And of course, I realise nobody wants to start moving to virtual education, closing schools even partially. The challenge may be that we're not able to get on top of transmission otherwise.
It sounds as though you're saying that closing hospitality venues, pubs, bars, restaurants, which of course has a huge economic impact, may not make that much difference when it comes to stopping the spread of the virus.
I think it will make some difference, but I think it's a limited difference. And the key thing is it sufficient to get on top of transmission whilst we have effectively households coupled together with schools and other educational venues? And we just don't know the answer to that yet.
Now, there are certain rules that we're all supposed to be living by, regardless of where you are in the UK. Staying 2 metres away from other people, washing your hands, wearing a face covering in crowded areas. If you stick to those rules and you're not mixing with other households, is it possible to catch the virus?
I think if you stick to all those rules, it's very unlikely you can. But unfortunately, a lot of people are unable to do that. Particularly some of the most vulnerable in social care have to have people visiting them each day to look after them. People who are in are not able to work from home or unable to do that. So it's an enormous challenge. We cannot actually shut down. Even in March, we didn't completely shut down the economy. There are essential workers who have to go to work, and that poses some risks.
Now, of course, everybody's worried about Christmas, and we had the warnings that we might need to get ready for a digital Christmas this year, and that large families may not be able to meet up together. If we were to relax the rules and just say for that one day on the 25th of December, family and friends can get together and they can mix indoors, how much difference would that make? I mean, is it possible to say you can have Christmas Day off, or does that risk massive transmission?
It's always a balancing act. It risks some transmission, and there will be consequences of that. Some people will die because of getting infected on that day, but if it's only 1 or 2 days, the impact is likely to be limited. And so that really is a political judgment of the costs versus the benefits.
And are you preparing for a very different Christmas this year? Is that your anticipation?
Yes, well, I mean, I'm living with my son, and I see him and basically nobody else at the moment. I'm looking for quite a quiet Christmas, like many people, catching up with friends, family on Zoom more than anything else.
Professor Neil Ferguson, thanks for talking to us this morning.
And the time now is 20 to 9. We're talking about Christmas. How about a very digital Christmas to you and a virtual New Year? It doesn't quite have the same ring about it. Oh, I'm sorry, I've moved on.